There are a few things that you can expect when you wake up after your surgery. You will have an intravenous therapy, or an IV, placed in your arm by the anesthesiologist prior to surgery. This IV will stay in place until you're discharged. We may use the IV to give you fluid for hydration, antibiotics, and pain or nausea medication if needed. If you've had your knee replaced during surgery, you might have a small drain called a hemovac coming from inside of your incision. The purpose of this drain is to let extra blood and fluid around the surgical wound drain in order to prevent excess swelling and so that the incision can heal. Your nurse will monitor the drainage and will empty the drain as needed. The drain will be removed on the day following your surgery. You might have a tube inserted into your bladder called a Foley catheter. The Foley catheter's job is to drain urine from your bladder. If you do have a Foley catheter, it will be removed on the day after your surgery. You may wake up with oxygen tubing in your nose. The oxygen tubing is usually removed once you're more awake and your oxygen levels return to normal. You will have inflatable boots on your legs called pneumo boots. These are special sleeves that inflate with air to help increase blood circulation in your legs to prevent blood clots. These boots should remain on for your entire hospital stay, both while you're in bed and while you're sitting up in the chair. You will be given a breathing exercise called an incentive spirometer. After surgery, you may not take deep breaths as you normally would. This will help you to take deep breaths and cough. It's very important to use this 10 times an hour while you're awake in order to help prevent a lung infection or pneumonia. While you're on the floor, you will have your vital signs checked at least every 4 hours. This includes your temperature, blood pressure, heart rate, and oxygen levels. If you're feeling up to it, you will be able to eat after surgery. Be sure to advance your diet slowly and don't overdo it. Your nurse will show you how to order meals using your room phone. Hydration is also important, so be sure to drink lots of water. We will have a list of all of your home medications. Your nurse will provide you with these medications, as well as some additional medications that you might need after surgery. You will be given medications for your bowels in order to prevent constipation that can be caused by the pain medication you're taking. It's normal not to have a bowel movement for several days after surgery. Medications that help with this include Colace or Senna. Colace is a stool softener that does not cause you to have a bowel movement, but makes it softer so that it's easier to go and you do not have to strain. Senna is a mild laxative that will help you regain function of your bowels. You'll continue to take these medications at home while you're taking strong pain medication. I should also note that you may not receive all of the medications that you take at home during your hospital stay. For example, some people take medications for high blood pressure. Since it's normal for your blood pressure to be lower immediately after surgery, we may adjust your dose of blood pressure medications while you're in the hospital. When you're discharged, you'll be given a list of all of your medications along with instructions for when to take them.